I'm Dr. Amy Brenner, and today I just wanted to address a common question that I got, even just this morning when I was talking to somebody who had had a prior hysterectomy, and she had said, so I had a hysterectomy, do I really need to keep coming in to get a Pap smear? And the simple answer is no. But the problem is so many women equate pelvic exam or annual exam and Pap smear. So first of all, just let me explain what a Pap smear really is. So when somebody comes in for a Pap smear, we put a speculum in the vagina. I see the cervix. I take this little spatula, this little mascara looking brush type of thing, and just get some cells from the cervix, put it in this little liquid. We send it off to the lab. The pathologist looks at those cells underneath a microscope and tells us, are there any precancerous cervical cells? Is it normal, or is actually their cervical cancer? So after a hysterectomy, the cervix is gone, and really you don't need to get a Pap smear. Same thing I hear, well, my doctor said I only need to get a Pap smear every 3 years or every 5 years. What do you think of that? So although that is the guideline for the Pap smear of what I just discussed, it doesn't mean that you don't need to go to the doctor anymore or go to the gynecologist anymore or only go to the gynecologist every 3 to 5 years, because you're more than just a cervix, and we actually do more at your Pap smear visit, or what I like to call your annual wellness visit, than put these swabs on your cervix. So you're more than that. At your annual exam, we do a whole head to toe physical. We do a breast exam. We talk about breast health. As far as a pelvic exam is concerned, you also have a vulva, a vagina. Many times women still have ovaries left in place. So from an exam standpoint, we're looking at all of those things. In our practice, we really like to shoot for optimal health. So we're discussing other tests that can be done outside of a traditional cholesterol test, something called the SpectraCell cardiometabolic test. And this is something that we offer all of our patients at their annual exam. And so with this test, and it's only about $50, instead of just getting the traditional lipid markers, you get all of these markers that each one of them is an individual risk factor for cardiovascular disease, as well as you get some markers that relate to your blood sugar. So putting all these together looks for more than just the 4 lipid abnormalities you get from a lipid panel. So that's something we offer in addition to the screening blood work we recommend everybody to get yearly. We also assess, are you a candidate for genetic testing? So hopefully that answered your question of, do I need to get a Pap smear every year, or do I need to have a Pap smear after I have my hysterectomy? The answer is we do more than just a Pap smear. And at the end of the day, it's one of the only things that are free in medicine is your yearly exam. Asterisk, asterisk, for most people with their insurance companies. So we'd love to see you for your yearly check. And we do more than just a Pap smear.